Oh,
Hello,
hello. There we go. Oh, okay. I thought these would connect, but that's all right. How are
everybody.
you?
Great. Welcome. Well, thank you for joining us today on Ask the Insider. Our conversation today is about allergic asthma. In light of Allergy and Asthma Awareness Month, I am Gabe Ortiz. I'm a physician assistant. I've been a PA for over 30 years, and I serve as clinical clinical educator for Thermo Fisher Scientific. And I've been working for about 28 years in pediatric pulmonary medicine and allergy. I'm extremely passionate about identification of allergic triggers for our patients with allergic disease. And in honor of our affiliation with Empowered Patient Program with Zestful, I'm here with Kortney Kwong Hing, Zestful co-founder and co-host of the Itch podcast. So nice to speak with you today, Kortney.
Hi, thank you for having me. I'm excited to talk about asthma.
Great, wonderful. We are thrilled to have you join us today for the Instagram Live. Allergy Insider and Zestful have a pretty extensive history working together. But for those who are not sure and familiar with the brand, please introduce yourself and tell our audience a little bit more about yourself and the mission of Zestful.
Yeah, so I'm Kortney Kwong Hing, and I'm also known around Instagram as Allergy Girl Eats. So you hear me talk a lot more about food allergies, but I live with the atopic triad. I'm like your typical atopic march. So I had eczema, asthma, and food allergies all starting very young. So I've had experience with all three, and asthma has been one of those things that comes and goes in my life. So we're going to talk about that a lot more. So, anyways, I started blogging in 2016 about my life with allergic conditions. And I moved from a personal blog and joined another allergy and asthma advocate, Shala, and we created the nonprofit Zestival. And our goal is to empower, support, and improve the lives of people living with allergic conditions. And we really are looking at the quality of life. So the social well-being of those people with food allergies, asthma, and eczema. We're looking more at like, you've been diagnosed and you've been living with this for a few years. Now, how do we help you improve your life and make sure that you're just managing your disease so it doesn't become your everything? And we've partnered with Allergy Insider to bring you Empowered Patient. And what we're really looking at is we're looking at how allergy testing and knowing about your diagnosis, so knowing your diagnosis and knowing the medical backing behind it, how that helps you become a more empowered patient, like what tools that gives you to feel like you can really fully manage your allergic condition in every aspect of your life.
Good. Yeah. Thank you for sharing, Courtney. Just a couple of questions I have for you. For someone, that has allergic disease, I don't want to say suffering, but right, we want to try to make sure that we manage
Yeah.
family, right? Family and lifestyle and everything else. Can you give our viewers maybe a couple of pointers on what has helped you manage your allergic diseases, maybe what questions you've asked and the steps that you've gone through to try to be able to live with your condition?
Yeah, I think it's a little bit different for all three. So food allergies, asthma, and eczema all have their own set of things that need to be managed. I could probably go off on all three, but maybe I'll focus on asthma just considering it's Asthma Awareness Day. And what's interesting is that asthma as a child was really managed by my parents, right? They were the ones who told me when to take my inhalers. They gave me the management plan, and they were just the ones who helped me make sure that everything was on track. I really took it into my own hands when I was an adult, and all of a sudden, my asthma was just coming back full force because I moved to Berlin, and the pollen in Berlin is outrageous. Like if I have a really scratchy throat, it's because I went for a walk with my dog and I like literally got rained on by green. It's insane. So I moved to Berlin and my asthma just it just came back in full force and I didn't know why, and it's because I have allergic asthma. I have several triggers, but I actually didn't realize that it was a problem until I knew it was a problem, and I just used my reliever inhaler a lot, like a lot. I was having anxiety if it wasn't beside me at bedtime, because I knew I'd probably wake up needing it. And I was telling that to an allergist, and I was just really lucky to be at Capitol Hill Day 4 years ago, and I was hanging out with an allergist, and I was telling her that, and she was like, "That is terrifying. Like, that is not the way to manage your asthma." And I was like, "Why? I just take it and I'm fine." She's like, "No, you have like an underlying inflammation problem, and it's just one day it's just going to get worse." So I was really lucky that an allergist, I just got to like hang out with an allergist, and all of a sudden her fear of like how nonchalant I was about using my reliever inhaler brought something up inside of me. And since then I've been advocating for it, because it's this normalizing of our condition. We're just like, "Oh, it's fine, I'll use my reliever, it's no big deal." It was funny because I was on like Capitol Hill advocating for allergies and asthma, but I had no control of my asthma at all.
Good point. Yeah. And I like the term that you use, normalizing, right? Trying to make it as normal as possible for you and your condition. But brings up, several topics, several concerns, and as we look at the asthma guidelines, the four core components, and we can kind of discuss those a little bit. So initially, when you were first finding out about your diagnosis, did they use some kind of an assessment tool? Or if so, which ones did they use? And are you familiar with any of those?
Yeah, so I've used the thing you breathe in it. I'm completely
Peak
missing.
flow.
Yes, exactly.
Yeah.
Peak flow. And they had lots of questionnaires for me, and also they took a very extensive history. And then I
Right.
also got some testing done. So also like correlated with my pollens. So they tested all of the different pollens that were coming at different times of the year. And they asked me, when was I having like these exacerbations, at what point of the year was it happening, and they were able to kind of pinpoint which pollens were my allergic triggers.
Yeah, yeah, and for our audience, Kortney, just to elaborate, exacerbations. We use exacerbations as, maybe healthcare providers or patients that have been used to it for a while. But just plain and simple, exacerbations is worsening of your asthma, right? And that could be from several things, whether it be allergic triggers, it may be, even foods can exacerbate maybe some kind of an allergic reaction. But as far as those assessment tools, you bring up some of those, right? You could use peak flow meters. There's spirometry, which is done quite often in the pulmonary office. Also, the asthma control test. Asthma control test has been validated for children 4 to 11, and there's another one that's validated for 12 and above. Certainly
Mm.
can be used from appointment to assess how your asthma has been doing. But let's talk about triggers. So how were your triggers identified, and how did you go beyond identification of those allergic triggers?
Yeah, so I've always known that most animals will trigger my allergic asthma. So animals were pretty easy for me to negotiate that. Really, what's happened in the last couple of years for me is the changing of, okay, I say 4 years, but I've actually been here for 9. But I've had like my asthma under control for 4 years. But for the first 5 or so was not so good. But I moved. So basically, I was like, spring was fine for me before I moved to Berlin. And then I moved to Berlin. And the first year I got here, I was convinced I had mono. Like, I went to the doctor. I was like, "No, it's mono. It cannot be allergy." And she was like, "No, you have spring allergies." So I was like, "I know what spring allergies are like. I'm from Canada. We have like ragweed." She's like, "No, no, no. You have spring allergies." And I was just exposed to all of these plants and trees and grasses that I've never been exposed to before. So we did the testing, like the different pollen testing, because I tracked when it was worse for me. When was I waking up multiple times at night to use my
Mm.
inhaler? So that's how we kind of went on to look at what my environmental triggers were. So I got skin prick testing for that. So we were able to determine, okay, at the beginning of spring and at the end of summer, this is when I'm going to have my issues, and this is how we're going to change my medication and my dosage depending on the times of the year.
You bring up a good point that as part of the assessment, it's always good to know what time of the year you get worse, right? For seasonal allergens anyway,
Yeah.
right? But it could be indoor allergens, any exposure to indoor allergens and maybe an idea of what caused you more problems.
Yeah, I mean, it was really just a change of environment because like during the winter when everything is totally dormant, I'm fine. Um, and I don't have we did a full panel. So we basically checked to see like if all of the like what is it? Uh I'm forgetting the I do this all in German, so I'm like I'm really
Yep.
good at medical terms in German, but like mold and dust mites and
Mhm.
all of the things that are in your house, because these are all really old buildings, and they were like maybe there's also something in environment. So we did it all, and it was really just like these are your pollens, these are your problems. So I was lucky that I'm not, allergic to dust mites or anything like that.
Yeah, just wondering whether or not it was your situation, right? I mean, we also talk about indoor pets. We know pets can cause quite a bit of allergy for someone that may have allergic problems, right? But it may not always be specifically the pet, right? So in testing, and doing that profile that you're talking about, which just means several different allergens, whether they be seasonal and or indoor allergens.
Mhm.
I know in our practice, many times, uh, patients get very protective, let's say, of the indoor pets, right? It's part of the
Yeah,
family. They're very protective. And if we start to tell them, oh, you may need to get rid of the pet, right? Well, let's find out first whether or not it is the pet in fact, because many times it may not be the pet. But if, for example, an indoor outdoor dog that goes outdoor during those specific seasons, right? Grasses, weeds, and trees,
yeah,
and outside collecting that pollen on their coat and bring it inside,
yep,
they may be, say, like a vector bringing in the outdoor environment. So, important questions to ask, certainly finding out, if there are any indoor pets or anything like that. But certainly great information when we look at those specific allergic triggers to be able to identify, are they indoor, outdoor, what are we going to do? And
yeah.
so moving on from there, Kortney, did you do any, exposure reduction, or did you do a combination of that and medications? And how did you move forward from that situation?
So I have controller medications that I'm taking, and actually in the fall I'm going to start allergy shots.
Okay.
Yeah, so I have this little, I don't have it by me, but I have to track every day kind of the pollen counts and my symptoms so that when we go in the fall, they can make the right mixture of, I don't know, allergy shots. So I'm tracking it pretty steadily so that we know exactly which combination will be the first and the best one. So yeah, I'm going to be doing allergy shots starting in the fall. Hopefully it'll
Hmm.
all work out.
Hmm. And in the meantime, we know it takes a while for allergy shots or immunotherapy,
Yeah.
right? For that therapy to take effect. Everybody is different. It could be 6 months, it could be 8 months, it could be a year, 2 years, 3 years, for it to become effective. So in the meantime, I also understand that you may have some allergic rhinitis, right? So you may be taking medication for that as well as reliever and more than likely a controller for your asthma, right?
Yeah,
And
exactly.
so when you first started, was it difficult for you to keep track of all this medication, and what helped you try to, understand what medication, each of the medications were for?
Yeah, that's a great question. Honestly, understanding what the medication is going to do really helped me. So understanding why I'm taking this medication and what it's doing in my body was the best thing that I could have learned to say this is why I never gonna miss it, because you're controlling the inflammation in your lungs, and that's what's gonna give you an asthma attack, So knowing exactly what's going on in my body and the impact of the medication is way more powerful for me than just knowing I have to take it like twice a day and it's going to make me feel better. Like, make me feel better, great, but really, what is it going to do? So, knowing what my medication does has been super helpful, and it also helps you differentiate the two. This one does that, and this one does that, and that's why you really need to make sure you're taking this one morning and night, and that one you only take when you really need it. Like that explanation's so clear for me, The fear, honestly, of having an asthma attack is what keeps me going and taking that medication, because like having nights where you sleep right through, that's a dream. Like not being exhausted because you're waking up all the time, that's the why wouldn't you be taking it every day, you know? The other thing is I keep them in separate areas. So I keep my controller and my reliever in separate areas. And I know when I need to take my controller, and I keep it in the bathroom because it's also something that I need to, wash my mouth out after I use. So I find it most convenient to keep it in the bathroom. It's like literally sits beside my toothbrush. So I always see it, so it's perfect.
Yeah, Kortney, you bring up some really interesting points, some really important points as well. First and foremost is that education that you got, right, about each of the different medications, what they're used for. So, I would be impress our audience, to make sure that if you are going in and having these discussions with your healthcare provider, understand what the medications are for, hoping that the healthcare provider is educating the patient and have them understand. I often hear stories where the provider may say, oh, well, here, I'm going to prescribe you an inhaler. Just go to the pharmacy and take this and use it as prescribed, right? But
Yeah.
understanding what they're for, I think, does go a long way in helping you. And really, like you say, it empowers you to be able to know what they're for, right? And when to use them specifically. And then you mentioned something about when you really, really need it, right? We want to make sure that if you're feeling, uneasy, say maybe that shortness of breath or chest
Mhm.
tightness, or maybe even, it may even just start with nasal congestion or runny nose, make sure you take care of that instead of thinking that, oh, it'll be okay, I'll just wait and see what happens. Well, that see what happens could be detrimental, and it could be an emergent situation, which we don't really want to get there, right? You have the
Yeah.
medication. You have essentially, you are empowered to be able to help yourself over all of those situations and instances. So you've mentioned some really good points, right? Being able to have that education, know what the medication is for, to be able to help yourself. So do you find it difficult, say maybe when you travel or when you go out, or when you go to maybe other parts of just the city? I mean, do you take all of your medications with you, or not knowing where you're going to be, or maybe if you are going to be exposed to some of your triggers? How do you handle that?
Yeah, so travel, I it's always a little bit tricky when it's like a time change thing, and I'm always like a little bit concerned about when to take my medication, but I generally try to just stick to my normal schedule as much as possible, just so that I know I'm not going to miss it, you know? But I have anaphylaxis, so I don't leave the house without an EpiPen, which means that I carry all my medication with me all the time anyways. I'm never going to be a girl with a really cute clutch. I'm going to be a girl with like a purse that I'm like hauling all of the medication possible, so I have all of my medication just in case anything happens.
Yeah.
And a scary thing is that like I have some family members who also have asthma, and I went on this really long hike with a family member, and they didn't have their reliever, and I did, and it was like, thank goodness I did. And I schooled her so hard afterwards, being like, you cannot do that, because if I wasn't here, how would you have gotten home? You know?
Yeah, always best to be prepared, right? Be prepared.
Yeah.
And I ask because, many times people might think if they live, say, in a high population area of a certain tree, right? And then you go, oh, well, I'm just going to the beach, right? I'm just going to the beach. You never know
Mhm.
if you may be exposed to maybe something new, or maybe something that cross reacts with a type of tree or grass that you may be exposed to. So always good to be prepared, not knowing that certainly if you have anaphylaxis and you need to have that epinephrine auto injector, I mean, that's something you should never be without. And it really doesn't even matter where you go. It may even be just to a restaurant down the street, right?
Yeah.
Because you never have to be careful with, as we talk about food allergy, cross-contamination,
Yeah.
and preparation of the food products.
Yeah, totally. Yeah, but the
Yeah.
thing about asthma is that I find, and one thing that I think honed it in for me is that, you don't know how bad an asthma attack is going to get. And that's why it's so important to have your medication on you all the time because, not every asthma attack follows the same blueprint. And when I was told that, that is like another driver to empower you to bring your medication with you because you don't know. Like you said, you might end up, sitting beside someone who's covered in cat hair, and all of a sudden you're feeling like your chest is tightening and you have no idea why, and your medication's not on you, and because you thought, oh, I'm just going, to the local cafe for a tea and I'll be fine. So that's always like, you never know what's going to happen. I think someone with food allergies always thinks of the most absurd scenarios in which you're like going to accidentally get like smeared with peanut butter. But it's the same thing with asthma. And that's like a story that I know someone has told me is that they sat beside someone with cat hair and they start feeling it. And I couldn't believe how allergic they were.
Yeah, good point. Good point. Because we know cat dander is actually very small, very easily aerosolized, and very it travels a lot of areas, right? So we know it can be carried in from the cat lovers on their clothing. They found cat dander in schools without a cat, supermarkets, shopping centers. So you never know, right? Your point, you never know, and you may be exposed to something. And so always important and to be prepared and make sure you have your medications because you never know where you're going to get exposed. That's a
Yeah.
really good. So let me get back to a point where you talked about, you identified your triggers, and did you have a rather lengthy session on discussion of what all of that meant, in trying to minimize exposure to those triggers?
Um, I didn't have a great discussion, I must say, with my doctors. It was just really quick. It was just like boom. And I'm really lucky that I also co-host a podcast about allergies, asthma, and eczema. And I have like an allergist on speed dial and text message. And we covered asthma quite in depth. So we have like 4 in-depth episodes about it. And I learned so much from her. And that was eye-opening for me. And that changed the way that I went to my appointments afterwards because I realized how little I knew after leaving my doctor's appointment. And I think there was a little bit of a language barrier. And I think it was like, oh, you got this medication, you got this medication. I was like, okay, I can do it. I know what I'm supposed to do. But just thinking about how, if this was the first time I was being given this medication, how overwhelmed I would have felt leaving my doctor's office. And that's why I really, really advocate for asking all the questions you can as much as possible and really asking, why am I taking this? Why? I think that's so important for us is we're being told as patients to take this because it's going to make you feel better, but that's not enough for us to feel empowered to go and actually take it.
Good point, Kortney. Would you give our audience any pointers on maybe where you can find more information? Certainly your podcast, right? Or any other sites that may have helped you identify or get more information if you needed it?
Yeah, definitely. So if you're looking at going to your appointment, I know that allergyinsider.com, Allergy Insider, they have a really great article. I wrote it. But they have a really great article about how to prepare for a doctor's appointment. And there's a printout that's included so that you kind of have the overview of what you should kind of think about when you go to the office. So like where you can put your questions, where you can put your answers, so you feel empowered to write things down because it's really overwhelming. I mean, I advocate for allergies and asthma, and I still go to the allergist and I leave being like, whoa, I can't remember what happened. So write it down. So go to allergyinsider.com. They have amazing resources to get you started. You can check out that article. The other thing is that we have a podcast called the Itch Podcast, and we have like a deep dive series. So you can go there. And the last thing I would say is that you can join us this year. Allergy Insider and the Zespel, we're doing a program called Empowered Patient, where we really ask, how has knowing more about your diagnosis empowered you as a patient? And what would you tell other patients who are looking at being more empowered? you know? So how do you really get there? How do you feel like now that I know my diagnosis, I can tell someone else it's worth that struggle to get to the allergist, to get to the doctors, to get to the pulmonologist, to ask the questions, to write the questions, you know? So those are my resources. Allergy Insider for the printable, the itch, and Zestful, and follow all of us.
Yeah, sorry, I lost my my volume there for a minute.
Oh, no worries.
So there's some questions coming in. I don't know if you have any on your side, Kortney.
I haven't really seen any, but I know that we got one over here in our chat.
Okay. Yeah.
But I think maybe it's a quick thing to, if we have 2 seconds. I know a lot of people talk about asthma with inhalers, but we talked about allergy shots or immunotherapy, and I think a lot of people want to know how that impacts asthma. Like, why would an asthma plan also include immunotherapy potentially?
Yeah, generally immunotherapy, right, or what we call those allergy shots, is if the medication that you have currently been on is either ineffective or you find that you need more medication than what what would be deemed normal, right? So immunotherapy, when we look at immunotherapy, and really that's what it is, we say a late term is allergy shots. But what immunotherapy actually does is it modulates the immune response within your body. And as you continue to take immunotherapy over time, it minimizes your response to that exposure.
Mm-hmm.
So I know different parts of the country are maybe a little bit different. Some allergists recommend a 3-year minimum, 5-year minimum. In our practice, we had patients that had been on immunotherapy for 18, 20 years. And they find that it does really help them feel better and certainly minimizes their response, their itchy, watery, runny nose, stuffy nose, wheezing, when they are exposed to any of those allergens. So it essentially builds and boosts your immune system. So it certainly is a very effective part of our treatment. It has been found that in certain situations, I'm not going to say all, they may be able to minimize some of their medication over time when they do that. So immunotherapy is a valuable part when we look at allergic disease.
Oh, that's really interesting. Yeah. I mean, that's what I was told, but I think it's nice. It did a really good job at explaining. And we have one more question. I know that we're like getting close to half an hour, but I think this might be an interesting one. Can you use your inhalers only when needed? Say you have anxiety, asthma, or seasonal allergies. I think that maybe, or seasonal asthma. I think that maybe that's talking about the two different types of inhalers. I don't know what you're the pro, Gabe.
Yeah, certainly, and talking about those two different type of medications, right? We have the controllers, which are
Oh,
essentially
sorry, reliever.
should
Oh
be,
no, sorry, I said.
yeah, the controllers which should be taken on a frequent basis, right? Many times providers feel that if it's done on a daily basis, you will control your symptoms, right? But you may always be exposed to something that may trigger, say, if it's a runny nose, and we say if it starts with a runny, stuffy nose, it may cause some shortness of breath, right? And a little bit of problems there. But then certainly that reliever, if you're feeling, like we say, not your normal self, right? It could be something as simple as, I think you had mentioned, maybe a sore throat. Maybe that sore throat may lead to some shortness of breath and difficulty breathing. Well, we don't want to actually get to that point where it becomes an emergency, right? And I kind of want to go back to one of the points that you said, and the idea is in controlling symptoms, because we never want to get to that increase in symptoms, what we call either a flare or an exacerbation, because you actually mentioned, even though you may have mild asthma, right? We know that patients with mild asthma can have a severe exacerbation. And we know that any exacerbation or flare or worsening of symptoms could become fatal and severe. So we never want to take that chance, right? We don't want to have any exacerbations any flares, any worsening. And the best way to do that is to control your symptoms and continue your medications on a daily basis.
Yeah, thank you. Totally. I think we're at time, but I know that we got one more question. Do we have time or should we leave it?
Let's see if we can take it. What is the question?
It's what can you do to asthma proof your house?
To asthma proof your house. So I think really the biggest thing is identifying your triggers, right? And then once you identify your triggers, there's certain things like, for example, mold exposure. We know mold tends to grow where things are very wet, hot, and at dark, right? So things like look for maybe leaky faucets in the shower, and mold generally can be maybe that brownish or black type looking fuzzy a growth, right, which may be under the sinks and things like that. Dust mites, we talk about dust mites using a pillow and mattress encasings, and certainly we know because dust mites need about 50% relative humidity, it may be recommended, and I often say in my discussion, East Coast, West Coast, Gulf Coast, which is high humidity, you may need a dehumidifier in the house. For indoor pets, one of the good things can be, especially for cat, can be a HEPA filter. HEPA filters generally done by the size of the room where you're going to put it. So generally recommended, you may want to put one in the living room or the den where you spend a lot of time, and in the bedroom. And always done by the size of the room, because that filter actually has to circulate that air in the room. So many times people say, oh, I'm just going to get the smallest one and the least expensive one. And that may not do the trick that we're looking at. But several things. But again, several education measures, as you mentioned, on allergyinsider.com. A lot of information that can help you there.
Awesome. Yeah, thank you. And I think one more thing I would add, like with seasonal allergies right now, because I said like I was raining and is I always shower at night.
Yes.
And I make sure that take off my dirty clothes, not my bedroom. Just because I know that if it's carrying pollen, and I have a dog, and we've assessed him many times about my asthma. I know that we brush him down every day in the spring, and we make sure that we wipe him down if he's definitely covered, because I think like you mentioned, and I think that's really important, is that he brings in a lot. I know he tracks in a lot, and maybe this time of the year he doesn't get as many cuddles from me, but he'll get some cuddles in the winter when it's cold.
And simply, if it's not the dog, just simply washing the dog like every other week, or maybe once or twice a month would really help.
Awesome. Well, thank you so much for clarifying all of that, Gabe.
Yeah, so there is, once we identify the triggers, are able to assess appropriately. Education, as you mentioned, goes a long way. Identification of triggers, identifying, what's a true allergy, knowing what you need to reduce your exposure to can really help you. And so, again, we talked about a lot of different multiple factors, right? We talked about education, we talked about medication, we talked about reduction of exposure. A multifaceted approach always works best. Several steps that you can do to help you out. You say, knowing what your pollen seasons are and everything will help you all together. But Kortney, it's been great speaking with you today. Thank you for joining us. Thank you for sharing your stories. I know insightful, really good information that will help our audience. And again, you can always reach out to any of those resources that you mentioned, your podcast, to get any additional information. Any closing comments, Kortney?
No, just, check out, like you said, Allergy Insider, because they have amazing resources, and you can learn more about our Empowered Patient program there as well.
Great. Thank you. And again, thank you to our audience for joining us today, and keep tuned for any other Ask the Insider on Allergy Insider. Thank you.
Thank you. Bye.